Right, I think we can get the webinar going. Hello, everyone. It's very nice to meet you, and we're so glad you tuned into this topic. And to start with, we have been having a lot of events in the past period when it comes to physical or online, but mainly we've been trying to create momentum and knowledge regarding all things related to ESG, data for good, and the use of data for sustainable purposes. And throughout our work, we have come to realize that we need to tie sustainability, ESG, and the data to different industries, or how we can merge both, or how can both serve each other, and how can the ESG and the sustainability not just be a topic of its own, but a very important topic and concept and strategy that needs to be embedded in all industries, not just when it comes to reporting and when it comes to the policy level, but when it comes to implementation and how it can also drive financial gain and how it can be of a very fruitful return when it comes to finance and profitability. And in doing that, we've attempted to create knowledge not just in how what is ESG and what is the use of data for sustainability, but we also introduced the basic concepts for that in our previous events. And today we are tackling one of the most prominent industries in the Middle East and Africa, and that is the healthcare industry, as one of of course, Dr. River will be introducing more about this in detail, how the healthcare system contributes to the waste industry, and how can we better utilize our resources and better introduce a more efficient perspective to the healthcare system when it comes to all those involved and stakeholders involved, but also to the industry itself and the success stories that are coming alongside with it. And not just sustainability, but also the use of data and technology, and how data and technology and AI can contribute to a more efficient healthcare system that benefits both the medical team and also the patients and all those beneficiaries who are always tied to the healthcare sector. And today, discussing a very important matter such as the implications of AI and how it can push forward and help the healthcare system to proceed forward. Weber Matur. And we're very glad to have someone who has been in the industry for so long and who has hands-on experience in that term. And I would love for you, Weber, to introduce yourself and tell us more about your story, your background, and the work that you do in the field of healthcare using AI, and how it all ties together using sustainability and in that framework of sustainability and being green and pushing the green agenda forward.
Thank you, Safi. Just a voice check if I can be heard correctly.
Yes.
Brilliant.
Let us know in the
Okay.
chat.
Sure. All right. So I am just going to pull up a few slides and while I would introduce myself.
We see it.
Great. All right. So a little bit about myself, and thank you for the warm introduction, the team. Well, I started my career about 18 years ago in healthcare. And in the last 18 years, when I look back, I probably have done every possible activity which forms a part of the continuum of care. So I started with health informatics, developing some of the solutions that were used by the hospitals with a product company, moved out, uh, worked with a team of like-minded people to build up some services which would help in patient care for a different organization. Then I finally realized that I have been spending a lot of time on, transforming things back in US, and this was 2006 and 2007. Uh, the the healthcare was getting, I would say, very heavily regulated in terms of the requirements for data submissions for grants, etc., which came in US and Canada between 2008 to 2010. So somewhere back 2010, I felt that I need to do something a lot more at a grassroots level. I was in India at that point of time, and I joined a chain of hospitals in India, and we started implementing. So it was a greenhouse, it was a paper-based hospital. We started implementing systems and transforming healthcare 14 years ago. A lot of learnings. So that kind of literally exposed me to spending a day in CSSD department, which is the sterilization department of a hospital, and seeing what are their processes, how do you transform them, bring in technology, to right up to the most critical areas, which is neonatal, PICU, NICU kind of environment, to see that the needs are a lot more complex in nature when it comes to how technology can help. So first, I would say 10 years of my career, I spent in understanding healthcare, what are the challenges, barriers to effective, care, etc. And obviously a lot of time was spent in understanding the technology needs. I moved to UAE in 2015, so it's been 10 years now. And after spending some time in Doha, a couple of years, and since I moved out of India in 2010, worked in Florida for some time. So last 10 years in UAE, I've been associated with the public healthcare system in UAE, which was Ministry of Health, which was delivering healthcare, and became Emirates Health Services. And my key responsibilities for the first, I would say, 8 years out of these 10 years have been to implement some of the data and analytics activities and transformations and drive the organization using data. So we tried our best to be able to bring in data into the hands where it should be, at decision making at all levels, right from care providers to administrators. Build some effective, capabilities and assets so that there's a decision making which is backed upon evidence-based data, etc. Now, sustainability, my passion towards sustainable healthcare and how I would love to utilize my experience and little bit knowledge on data and AI in sustainability started in 2000, I think post pandemic. Perhaps everyone was too busy during COVID-19 to kind of make things sustainable, but not in a very holistic sense, kind of more of resilience and recovery. So I would say 2021 is where I started focusing a lot on, which is fine. Now, these are the limited resources we have. World has evolved. How do we make sure that these limited resources are well utilized and we have a very sustainable model for the next few years? So the questions which started arising, across the spectrum were, what's our carbon footprint? Is there even way to measure a carbon footprint? How can I reduce that footprint, etc., etc. Right now, that led to, so I would say I'm honestly no expert in sustainability in healthcare. Just this morning, I was in Arab Health Exhibition, which is an annual event which happens in Dubai. Most of you would obviously know about it. And I was listening to a panel discussion where some of the speakers was talking about sustainability in healthcare, and it's amazing. It's mind blowing on how much of effort globally is being spent and invested in kind of building this field. And that brings me to the fact that I think when we spoke about doing this webinar with ESG and Data for Good Center of Excellence, there are two things which I would love all of you to take away from the webinar. And one, if I can ignite a little, some of you may already be well aware of the field, maybe doing some great work around it. So one, I would love you to take away some healthcare use cases. In case you're already a healthcare expert, then maybe some of the ideas which I would bring in would trigger some further thoughts. But yes, one of my objective would be to kind of pass on some of the ideas around how data and AI can be utilized, or data for good applies to a sustainable healthcare. I'll share some of the stories, some of the challenges we came across and we tried solving, and while some of the aspirational use cases which we would love to develop in the coming future. Second key takeaway would be around for some of you for whom this is a new field and maybe you're doing some sustainability efforts in other domains, is just to get excited about the possibilities that lie ahead in the next decade when it comes to linking data and informatics and AI to the entire sustainable healthcare spectrum. So if feel free any put on questions in the chats. Like I said, I'll try my best with my little experience and knowledge to share those. Some of the questions I would love to come back in case if I'm not able to answer post the session. All right, some
Thank
forward.
you, David.
Thank you, Safi. Forward-looking statement, some customary, declarations that I do represent Emirates Health Services organization, but obviously this is I think there's some chat from the participant that there is a noise behind. Is there anybody else who is hearing any background noise?
Please let us know.
Okay. All right, then let's get going. So I often get this question asked by a lot of people. What exactly sustainability means in healthcare? It, some of us who have spent a couple of years in healthcare domain understands that everybody is striving towards the same goals, right? Every individual working in healthcare across the globe is striving towards better patient outcomes, making our financially any health system sustainable to be able to provide care in a long run. Third, giving a patient the better experience and best experience, I would say, right? So keeping patient at the center, so patient centric, and the entire, I would say, philosophy of making sure that the experience which your customers, no longer patients, carry is evolving over a period of time. And last but not least, reducing the provider burden, right? So this is how, whenever I wake up in the morning, I keep these 4 pillars in my mind, and that kind of gives me the push to keep trying something or other, to improve any of these pillars. Now, how does it all link back to sustainability? The actual definition says healthcare that delivers high quality care in an affordable way while minimizing the impact on the environment. There's so much, so depth in these words. And I kept on wondering, honestly, when I put together the slide for the webinar, that it kind of encompasses all the 4 pillars I spoke about, right? That we want best for our patients. We want to give them the good experience. We want to make it affordable so that there is an access to healthcare and the health systems are sustainable. While the sustainability pillar is now getting added, which is becoming very crucial, that all this is causing minimal impact on the environment, which is where that, I would say, linking of sustainability to healthcare to data and AI comes into the picture. And next few slides would probably walk you through what we have done and what we want to focus on. Just to keep it interesting, Sustainable Development Goals, I'm sure all of us would have heard it. Some of us may be reporting these goals to United Nations and to World Health Organization, and maybe extensively working on these. Any idea how many SDG goals exist currently?
I mean, definitely the attendees who were with us in the last webinar would definitely know the number.
Yeah. So that's an easy one then.
Thank you for the chat answers. Perfect.
Okay, great. So yes, 17 goals exist. And my next question is, again, an easy one. Which goal is related to healthcare categorically? I see some interesting answers coming in.
Yes.
All right, brilliant. So yes, it's SDG 3, which is the next slide. Now, somebody said 17. Now, the way I look at it, I've spent a lot of my time over the last few years on SDG goals. One, to report those goals as a public health system, data on those each of those indicators. Second, to link the initiatives we would like to drive to sustainable development goals. Third, to show progress on these goals, which overall elevates the rank of United Arab Emirates, the country which I work for, and be able to progress further on each of these sustainable targets which we have set as a country for SDG goals. So in that experience, I do realize that there's so much of obviously overlap between SDG goals. While the SDG 3 focuses on good health and well-being, but nevertheless, I would have, for example, climate action. Now, we were doing one of the, I think I'm speaking about that initiative in the next few slides, but a lot of initiatives which revolve around sustainability in healthcare actually have a tick in the box for not just one SDG goal, but a couple of them. So we were able to reduce carbon emissions, which obviously helped us achieve some of the objectives of SDG 13. There were some partnerships that were fostered, which helped us accelerate the momentum on SDG, which led to our targets being met on SDG 17. So, in fact, WSIS, which happens every year, and now they're actually open for submissions of ideas and projects as we speak. If you see, whenever we submit any idea which aligns well with WSIS strategy, they give this as a multi-check box that this particular initiative is supporting how many SDGs, because that's how it operates. But just to kind of create a curiosity and interest, there's a whole lot of focus which goes around SDG 3, which is good health and well-being. Now,
Absolutely. And in that regard, Viber, because I mean, we have tapped on how the AI is transforming the industry and it's changing the way healthcare is being portrayed, and how it's contributing to how can AI solve not just the health problems, but in a collaborative manner and a partnership manner with so many partners who are aiming to solve the challenges of the healthcare sector. So to tap more onto the sustainability aspect. So within the healthcare sector, can we go beyond the fact that we just need to reduce the carbon emissions and understand better how even AI can support the healthcare system in lowering such emissions, but also to focus on the care given to patients and improving the type of services that is being delivered to our patients, and also simultaneously and jointly minimize the environmental impact, because the environmental impact can go hand in hand with not just the minimization of the carbon emissions, but also can enhance the experience for the beneficiaries, such as the patients. So I would love for you to tap on that further.
that's a brilliant question, and my perspective on this is that there are no initiatives which are actually sustainability initiatives. It goes back to the 4 pillars I spoke about, which I genuinely believe everybody working in healthcare focuses on, either of them or multiple of them. That sustainability to me is a horizontal. Every initiative which leads to a sustainable healthcare has to solve not a sustainability challenge, but solve a real healthcare problem while making sure that it is being solved in a sustainable way. That has been our approach as an organization, my approach personally as an advocate of sustainable healthcare. And I'll give an example. Uh, we spoke about carbon emission in the question, right? That there are a lot of initiatives running across the globe to reduce carbon emission and to be able to kind of achieve your net zero targets set by different countries and across the globe. While to me, the goal is not to reduce the carbon emission or carbon footprint. For me, the goal is to provide a smarter care to the patients while achieving a reduction in the carbon footprint. So that's how I see it, that any AI initiative has to make care better, more accessible, more affordable, and overall reduce the burden on the health system, on including providers. Now, if your AI initiatives are doing what they are supposed to do in a health system or in a health environment, while they're being developed in a way that it is not causing a major impact on the environment, like we saw in the definition, that is nothing but a unification of a sustainable approach towards AI, or AI driving sustainability. It's a two-way street, right?
Yeah.
And that's how I look at it, Safi. I don't know if that answers the question, that it has to solve a healthcare problem in a sustainable manner, and that's my definition of sustainability in healthcare.
Perfectly said.
Thank you. Uh, Moving on, this is going to be the focus for the next, I would say, 10-15 minutes. We'll talk about some of the use cases which we implemented, and I would love to share our journey, our challenges on these three initiatives which we launched, which I like mentioned, that are solving actual problems in healthcare while helping us achieve our sustainability goals. So the first one is reducing the carbon footprint. That's very interesting where it all started. Like we discussed in the previous question, that our challenge was not, we didn't start one day to say, hey, I'm going to reduce the carbon emission of EHS, right? Honestly, that was not the target. I'm not saying that's not a good target, but we didn't start there. We started with the fact that there are so many no-shows across our primary care centers. There is so much of, I would say, optimization that can happen between one clinic to another clinic in terms of utilization. There are so many patients who are actually traveling from one city to another city for access to a particular care, which can be provided way nearer, etc. Now, as we know, because it's an open public, open health system, just like a lot of countries in GCC, I, as a patient, I have the right to choose my provider. While that works very well in majority of the cases, but it kind of leads to a very different challenges when it comes to providing sustainable model of healthcare, right? So we started looking from that lens, that how can I reduce the patient travel and give smarter options and ways to be able to reduce the patient travel for similar outcomes, making sure that those outcomes are benchmarked to actual consultations. Now, telemedicine is not a new field. It has always existed. COVID only, I would say, accelerated the adoption of telemedicine, etc. But the aspect we brought in it was not telemedicine. The aspect we brought in was that how can I utilize some kind of an intelligent algorithm to be able to identify that which visits were potentially can be converted, could have been converted, and can be converted to e-visits. That's where the AI, I would say, came into the picture to say, let's do that. Now we started looking at, obviously, whenever you start building a new algorithm, you start looking at what studies have been done across the globe. I came across a study at NHS, which I would love to share, over the chat after the webinar. They studied, there was a hospital, I think, I don't know if it was Birmingham, if I remember correctly, but they studied the patient travel and the associated carbon emissions, and they built some kind of a simulator. So we started from there. We said, let's measure our carbon footprint due to patient travel. Let's benchmark it to the global standards, etc. And second, once you have measured how much of carbon, footprint exists due to patient travel, second, identify what type of care can be converted proactively, which may not require a patient travel. That could involve, one, maybe having a closer access to particular care. Second, providing technology solutions to be able to get seamless care. Third, be able to kind of do more of a, I would say, patient engagement, to be able to drive or give it a push so that they are able to utilize the same care which they have in their vicinity rather than traveling further. So the AI model actually started identifying such visits based on the patient demographics, so the model was trained obviously on patient demographics, on the type of medical services, all specialties, cannot be converted into e-visits. So model started suggesting which ones would have the ability to be able to convert. We um, we started looking at the outcomes of, we already had so much of e-visits happening, so started looking at the outcomes of certain services which were delivered through e-visits over a period of time versus the quality of care in physical setting, to be able to pick up those services which we know that quality and the outcomes would not get impacted, etc. So all that was fed into, into the algorithm as the key indicators to be able to train this algorithm to start suggesting. So what eventually happened when we embedded this algorithm into a mainstream? Now I'm digressing the topic a little bit from sustainability, but a lot of people on the webinar would echo the same sentiment that there's huge investment which goes in building any asset when it comes to artificial intelligence, whether it's a neural network, machine learning model. Now I'm seeing in the chat, people, somebody mentioned about the Gen AI, it's going to completely transform, which it is already transforming. Now, with all that investment, there's so much of studies published that sometimes even single digit, if not double digit percentage of these models actually get implemented in a real healthcare setting. And our experience has been similar. I won't deny that. So we started looking at this model, that it should not be another model which would be developed with so much of effort and may not be utilized. So we embedded this into the actual workflow, and that actual workflow was appointment management system. So when a patient requests an appointment, the model started identifying the probability of that patient to be a no-show. And second, if it started highlighting those visits that can potentially be converted into e-visits based on the parameters which I mentioned, right? And after heavy training. So, and it led to some amazing results, because when our patient engagement teams or call center teams who were booking these appointments, they started coordinating with the patients to say that, hey, and I'll give a particular example. We have had cases where some of the services like dietetics consultations, uh, when we started measuring using our carbon simulator, which started, we had patients traveling 35 to 40 kilometers to meet a particular dietitian, whereas some of these follow-ups could have easily been done on a telemedicine platform. So we started targeting certain specialities first to create that trust among the general public, to say this is what would lead, this would. And the best part of it was, because the simulator was giving us the, based on the patient's address and the location of the care, it was giving us how much of carbon emission. So it was like a gamification dashboard. It was giving us how much of carbon emission would be, generated by this patient travel. So when we had some very interesting results, when we started sharing that data with the patients, they became a lot more engaged in this journey. They felt that while it's just not about e-visit or a telemedicine, but it's also about the fact that they're contributing to the overall reduction in carbon footprint and overall improvement in the sustainability across the globe. So that was
And
our
and not to mention the social aspect of it. I know this is contributing also to the service that is being provided to them. I mean, a patient would definitely sometimes it be very difficult for them to proceed to the location of the hospital or the place where they can get care. So they would really, really, really benefit in terms of health purposes, not to make such a commute in the first place. So it's environmental, but also it's humane and contributing more to their or catering to their health needs at the moment in time.
Absolutely, very well articulated. And I'll give you my personal example. I have two kids, and as they're growing up, uh, my my spouse is very particular about, when it comes to their care, right, which every parent is. And we had this barrier over so many years that I want to see a pediatrician right in front of me, even if it is a mild temperature increase, even if it's, I know that spending so much time in healthcare, I exactly know what the prophylaxis would look like, so on and so forth.
Yeah.
But it was I would say, mental barrier, which is where the data for good comes into the picture. So when our patient engagement teams started focusing on on certain specialties, and they started educating the patients to say, uh, well, you live in this part of the city, your appointment is here. We have a small initiative which measures your carbon footprint. And this is your carbon footprint if you travel while we have a service. So there was a lot of data that was exchanged in that conversation, which is where the AI model and the carbon simulator actually helped empower the teams who were talking to the patient. That actually led to the results, honestly, not just kind of picking up the phone and telling them that, why don't you convert your appointment to e-visit? Our success ratio was way higher when we brought in the data and the AI aspects to the entire picture, which is my, which was my takeaway from this session, and or requested takeaway from this session, that built in that data story to be on whatever AI model you're developing, link it to the sustainability and engage your stakeholders for the successful implementation. This project eventually led to 15 million tons of carbon savings in around 18 months of time. We're still measuring this on an annual basis, identifying some improvements to the model and which specialties you would like to focus on, etc. That was one of the first ones. Now, this talks about, in summary of this project, this was well recognized project, and I take pride in it. One part of the solution, as you heard, was a carbon emission simulator. There are some amazing, for some of you who may be interested to kind of build something like this, you don't have to build it from scratch. That's the good news. There are carbon emission simulators already available. So we also looked at the simulator that was released by UNESCO. And then there's a lot of studies also which have come out. So we looked at some of the papers which were published across the globe on measuring carbon emissions based on the taking standard emission per vehicle, type of vehicle, etc. So we built in all those factors, and there were a lot of data points which were missing, honestly. And we had patients whose address was not correct. So it led to several other initiatives in terms of capturing the right data, improving data quality, all that was going hand in hand. Second, enhancing our e-visits with metaverse clinics, and it doesn't have to be necessarily metaverse. Metaverse was something which we tried, and to be able to kind of provide that actual environment. But we eventually linked it to our telemedicine setup, and it doesn't have to be anything beyond that, not necessarily. And third, which was the crux of this entire sustainability initiative, was the AI-driven virtual visit prompter, which was prompting with exact amount of carbon emission that would be spent and how this would save in the carbons in a big picture. I'm just going to play a short video before we jump to the next initiative.
Emirates Health Services is pioneering the use of artificial intelligence and telemedicine to reduce the carbon footprint of our healthcare services. In the first phase of this innovative project, EHS focuses primarily on reducing transport-associated emissions, which is close to 17% of total emissions in any healthcare system. Using statistical models, it was estimated that 500 million grams of carbon emission are emitted monthly due to patient travel to different EHS facilities for in-clinic appointments. EHS Intelligence Platform, the state-of-the-art enterprise analytics platform, analyzes the large data related to patient visits and uses an intelligent algorithm to calculate the related carbon footprint of patient travel to EHS facilities. The novel artificial intelligence algorithm identifies the in-clinic appointments that can be potentially converted to e-clinic appointments. The recommendation is provided to the patient engagement teams managing the patient visits to discuss and convert the appointment to telemedicine. This proactive approach of increasing the use of telemedicine with the help of AI will enable EHS to have an estimated carbon footprint savings ranging between 0.70 to 372 kilograms CO2e per consultation. Furthermore, the environmental benefit of promoting telehealth will not be limited to reductions in transportation-associated emissions, but will also enable EHS to care for more patients without increasing outpatient clinic space. This will help reduce the overall carbon footprint of the organization. The objective of the program is to establish EHS as one of the greenest healthcare providers using AI to reduce its carbon footprint. Use AI to increase the e-visit to in-clinic consultations ratio. The project plays a valuable role in the transition to a low-carbon emission healthcare system, aligned with UAE Net Zero 2050 strategy. It will also use technology to reduce carbon footprint while increasing the services and improving the...
All right, let's move to the next one. I know I would need to be a little more faster. I think the topic excites me a lot and I kind of go very deep into it. So a very simple quiz: how much percentage of carbon footprint usually comes from a patient travel?
That might be a tough one. But I mean, please send your answers on the chat.
And that's okay. I think so. The answer is, yeah, I had, okay, brilliant. Ahmed had a right answer, 17%. Now, it's not obviously a fixed number. It varies from system to system based on the geographical spread of access to care, etc. But this is a usual, and this is something which we estimated for our health system. I've had studies which we read earlier in UK. Those studies said 14% in some health systems, but it ranges somewhere between, between, I would say, 5% to 25, as high as 25% in areas where they may not have access. Last question: which AI model can help reduce patient travel? Prediction of no-shows, identify appointments that can be e-visits, or emission prediction model? That's an easy one. I think I spoke in depth about this AI model which we developed. Okay, so let me give out the answer. Yes, the e-visits. Thank you, Dalia. So the model which actually helped us was the e-visits model. Let's quickly look at the digital twin of hospitals. This was our next initiative where digital twin is not a new concept. Most of us would have heard about digital twins, right? And now again, I'm trying to link in some of these AI initiatives, AI models to sustainability on how we
Allow me, River,
utilize.
just to address a quick thing
Please.
while we dive into the models in depth. Um, Building on John's question in the chat regarding the tools that are considering not just the trips or the e-visits or the carbon emissions of making such commutes, but also the water consumption, the energy consumption, and overall carbon footprint. I mean, we have already modeled one of the topics that we are, or one of the programs that the EHS have already pioneered, and we'll talk further about other projects. But I'm sure that Weber will be able to tackle more this area at the end of the session. So stay with us till that point. But also regarding the models, Weber, I believe that we discussed so many aspects to the solutions, and which comes from the data collection up until someone who's already taking care of the data of the patients, and then the analysis aspect of it, and people creating a model that suits this type of data, and then the data storytelling overall. We see a whole picture coming together, so many elements that are needed to make such an assessment, not just the data people, but also the sustainability people, and understanding exactly what are the metrics that we need to account for, and what would be the most efficient metric to tackle first. And here AHS tackled the CO2 emissions from the commutes done by the patients. And there are so many roles that can be played within this story. I wanted to tap on it quickly before we go through to the model. How can we create synergies between such different roles, and what kind of competencies are needed to create such a model? I mean, we have the AI experts, the data experts, the sustainability experts. What does it take to make this whole story come together? What are the different roles? And for example, the people who are with us today, how can they start maybe moving towards a solution, better understanding what could they do, what kind of skills they could need in order to be part of this?
Thank you. That's a brilliant question. So I'll again share my experience. And one there is obviously data skills which are required, understanding the data, and people who, the role can be defined in multiple ways. Somebody calls them data analyst, data experts, data scientists, etc. But we need people who would be able to appreciate what that data is telling and convert that data into some kind of an, information and knowledge. So that journey from data to knowledge, which would require some kind of any tool you could use. We extensively use Python, which is open source. We also utilize one of the industry standard, analytics platforms, etc. But irrespective, there is an obviously skill set which is required to be able to convert that data, clean that data, and put that data into the pipeline to be able to derive some meaningful output. The second set of skills, which I would say are business skills. I've had this challenge a lot of times that amazingly talented data skills and data teams have developed assets which were not developed in alignment to the business needs, which may be clinicians, which may be administrators in this case, and those projects did not get the outcomes which were anticipated. For example, when we started the project of digital twin, we actually sat down with every single key stakeholder which would get benefited from this project. And so was the case with carbon emission. Now, if you look at the profile of the people who are utilizing that simulator, it's the administrators, it's the clerks in the hospitals and the clinics who are actually using it. So if their inputs were taken right from the beginning, that how would the simulator look like? Would it help? Would it be an additional tool? They're already, stressed out in making these phone calls. Now, if I give them another dashboard that while you're doing all this, you got to look at this and then take a decision, it's not going to work. It has failed so many times in my career and continue to fail. So that is where the second set of skills I'm focusing on is the business skills, that we understand how things work in a health system. You would need people to be able to guide, to make sure that they engage the right stakeholders, they work hand in hand with the business teams. Solutions which are being developed are completely in alignment to what the business needs, right? And if there's a solution which business may not require or may be way ahead of its time, then maybe it's not the right time to develop that solution, or maybe there's need to do education, etc., right? To kind of third and the last set of skills, which I genuinely believe is an executive sponsorship. There are a lot of times where we have had that challenge that if there is not right executive support, these projects become, POCs rather than an actual implementations. And I've had that experience. So a lot of projects which had the right executive support, and there are multiple ways. I'm not going to dwell into how to get the executive support, but you would need people who are able to drive this, get the right executive support by convincing the executive, getting the right executive support, convincing the executive teams that this is going to solve XYZ challenges, will bring in this benefits to your and to your objectives, aligning them to strategic goals, etc. There may be a lot of other skills, but I believe if I have to redo all this, then I would focus on these three tracks or these three skill sets.
Thank you very much, Weber. That's quite enlightening. And also people-centric, because it's not just about the result that they're providing, but also it's about how to utilize the internal team to best arrive at the solution without overwhelming each and every special or specialist with details that is not really relevant to the role. Perfect.
Absolutely. Spot on. So very quickly, so how did we utilize the digital twin of a hospital, right? Now, digital twin actually enhance the performance and efficiency because we were able to simulate the carbon emissions and the overall energy consumptions in the environment. Now, I'll give you an example where this was very, very helpful. The digital twin of a hospital kind of became a lab for us to be able to validate our findings when it comes to the reduction in the energy consumption. So, for example, we were switching on from one type of ventilation in a particular care setting to another type of ventilation. And obviously there was a data which was available to us, but we wanted to scale up that data to be able to see that our anticipated savings would be exactly similar to what I'm able to calculate using the model. So we applied that on the digital twin of the hospital, and we had a very high accuracy when those changes were implemented. So this is where the digital twins were utilized and are really helpful. They help you to identify your sources of emissions, analyze how much of carbon efficiency you could gain, and reduce other emissions by kind of making the changes you would like to experiment before scaling it up in an actual hospital. Now, how difficult it is to build digital twins? Well, it needs an investment in terms of time, effort, and money. Uh, they're not easy to be built, but we kind of piloted this, building up a digital twin of a couple of hospitals, utilizing one of the standard platforms with one of the partners, and it actually led to so much of an ROI in the long run that cost. And this is where the executive sponsorship comes to the picture, right? So the cost for that investment did lead to so much of returns in the long run. This is the next initiative which I want to talk about, which is solar panel dashboard. Now, obviously every organization heavily focuses on the sustainable sources of energy. We focus on solar panels as well, but the data and AI aspect, which is the fascinating aspect, comes in here. So we had the system called as WECOM, which is the electronic monitoring system. And again, most of the sustainable energy programs nowadays, they come with such standard, I would say, monitoring systems. But there was something fascinating we did. We built in a forecasting model and incorporated into it. And so the data was getting updated every 5 minutes and from the control panels. It gives us the comprehensive data, enough data to be able to analyze that how much of it is being generated, how much is being utilized, what is my net impact based on my weather conditions, based on different other aspects of my efficiency gain, performance ratios, etc. So I had huge number of data, and that's where it came into the pipeline of the data team that why don't we utilize this data to be able to do the conversion to solar panels in a much more efficient and smarter way. So we started building this forecasting model. We started forecasting that if these solar panels are put up in a particular hospital where they're currently not used, what is my forecasted reduction in the emissions? What is my performance that would come up, or I'm anticipated performance? This is where your data modeling exercises come into the picture. That's exactly what we did with this energy forecasting dashboard, that we brought in the data science hand in hand with a very simple business operations. And the huge amount of data that was getting utilized or generated started getting utilized to be able to lead to a lot of strong sustainability initiatives. All right. Now, I think there was a question on the chat as well. If I briefly saw it correctly, that what are the different ideas which is where the data, AI, and sustainability are all coming together. Now, I tried my best to put together some of these areas where we want to work on. We're working on some of them. The highest carbon, this is not a pop quiz, but I just wanted to keep it exciting for people who have spent some time in healthcare, if they're on the webinar. Any idea which is the highest source of emission in a hospital, or what is the highest source of emission in a hospital or in a tertiary or care setting, if not primary or secondary?
Could you repeat the question again, Vibert?
Okay, so the question is, which part of the tertiary care, which part of a hospital generates the most carbon or has the highest emission? or which part of care in a hospital?
Okay, okay. Could you
Okay,
give us some
that's
examples?
yeah. So that's a tricky one. So surgical
And then
area
we can
always.
pick which department that could be producing the most waste, because I have
All
some
right.
ideas and I would really like to validate those.
Okay. Now I'll make it easy, Safi. So it's always the surgical unit and operation. Somebody said that. Brilliant. Okay.
Yes.
So it's always the surgical area which is the highest source of emission. And I didn't know that until 3 years ago, before the sustainability bug bit me and started focusing on, like I said. Then when we dig deep, anesthesia being used for, so whichever surgeries, anesthesia is the largest source of carbon emission, right?
Yes.
And the anesthetic actually leads to the highest emissions. Now initially we had picked up that as our project, but there were a lot of challenges or barriers because it's a very clinical, I would say, decision, right? Now, we had this brainstorming with a lot of business teams, chief medical officer, and we decided that let's focus on patient travel, which may not be the highest source, but it's far more easy to make the interventions. And this is where the executive sponsorship, like I said, comes into the picture, etc. But the reason I brought up surgical is because that's our aspiration. We are focusing on, a lot of hospitals globally have done that. They've changed, brought in policies and procedures, maybe change of anesthetic, utilization, bringing in some smart tools to be able to reduce the wastage of anesthetics, etc., and has led to a huge impact on their carbon footprint. There is a hospital in UK, one of the trust, which declared their surgical unit as a net zero unit and a net zero
Wow.
operation theater. So some of the surgeries which happened did not had any emission, net emission released into the environment. So that's the dream eventually, with the whole world moving towards net zero. UA committed to a net zero target, and
Absolutely.
in several years down the line. Now, going back to the use cases, so these are some of the other use cases where we're trying to link AI and data into a sustainable healthcare or achieve sustainable healthcare goals. Uh, Definitely, it revolves around e-visits. There are satellite services, remote patient monitoring. When it comes to patient engagement, our care gap analysis, and these are small interventions we're trying to do when it comes to informatics and AI, to be able to lead to a very big impact on our footprint, and identifying. So the simulator which we developed, we're trying to expand that simulator to other business operations in healthcare to be able to measure what is the footprint, benchmark it, and then decide that this is an area where we want to focus on, because obviously everybody has limited resources. So we would like to pick up those projects and initiatives which have the highest impact, while making sure that that they're transforming some of the aspects of healthcare which we spoke in the beginning. So I'll obviously leave these ideas with you, and uh, happy to collaborate even later, just to exchange ideas, and perhaps work very closely with Data for Good Center of Excellence to see some of these ideas could come into light.
Absolutely. We were actually, this is such a boost and a push towards a very, very important cause. And I mean, through the Center of Excellence, that's what we're trying to do. We're trying to create an innovation pathway or a channel for stakeholders, different stakeholders that are innovators, who people who have already a background in data, in sustainability. They can come together, and then we can create maybe an innovative space for them to start brainstorming for solutions. Because I mean, if there is success stories such as the net zero or zero emissions surgical unit, such as the one you mentioned, I mean, it's really possible to start implementing that even on a smaller scale. But very much so, we need the vehicle or the vessel for it to be happening right now, or to facilitate such solutions to come to life and to start implementing real change in the sector. Vibra, that was enlightening. Thank you so much. And I believe we can definitely start taking this further through future events. I mean, we recently had a hackathon that tackled carbon emissions challenges through the use of data and arriving at different models that will better mitigate some certain challenges in the environment. And we can definitely do that as well for the healthcare industry. That's what we're here to do. So, and I would like us to proceed to our last bit of our webinar, which is to answer the questions, and we'd like to know more about that in the chat. Thank you very much, Viber, and allow us to have some quick Q's and A's before we go.
Sure, would love to.
We have in the questions and answers aspect, there's someone asking about whether we can have a recorded session of the webinar. Of course, we are going to be publishing this webinar on our website, the Center of Excellence for ESG and Data for Good website. And all those who attended our program already will receive emails after that, or our session today. And our second question would be, what's your vision, Viber, and expectations for the future of AI and AI agents and their impact on business? I mean, hospitals are a business in a way, and we have
Absolutely.
and it's very, very important to utilize such tools and such innovative solutions that you've mentioned today for advancing or enhancing the different businesses, particularly businesses in the healthcare sector, while maintaining a sustainable angle. Tell us more.
Brilliant question. So, agent AI or agentic AI is the next big revolution. It's already there, but I genuinely believe, in my humble opinion, that AI agents are going to replace a lot of administrative tasks in healthcare specifically. When I walk around the hospitals, for the last 2 decades of the time I've spent in working in all different geographies, health systems, challenges are similar. There's so much of administrative activities that are taken care by our nursing workforce. And I genuinely believe for so many years that if some of those activities could be reduced, they would focus on where they need to focus on the patient care. So going back to the question that how do I foresee what's my vision that how AI agents would eventually bring sustainability. Now, my experience has been that a new technology or a transformative technology initially may not be sustainable so there is always a runway, and I've seen that across. So when we started metaverse was not a very sustainable model because of different reasons, right? So the investments which go in, the setup you need, etc., the infrastructure. So and you have to make it sustainable in the long run by bringing in the aspects of the outcomes which it would bring in. Second, by keep optimizing it towards sustainability. So that's exactly what's going to happen with agents AI. And I genuinely believe that all the organizations which are making investments towards bringing in AI agents, they may not be able to have a pin down on a number to say that this is how it's going to be sustainable in the companies might claim to say that this is very sustainable, but this is hard fact that it's going to have its own maturity cycle to be able to first impact the healthcare, reduce the burden on our care providers, and eventually lead to a more sustainable plan in the near future. But yes, it needs to be thought about it right now. I don't know if anybody has really put their heads around it. It's a brilliant initiative to take upon.
Absolutely. And thank you, Robert. This is such an insightful take on it. As in, of course, it's still a collaborative process as we speak. If there is any other questions that you may have, we still have a couple of minutes before we go. Please let us know if you would like to contribute a question to Weber.
Hi, Viber. It's Nurhind. I actually have a question.
Yes, please.
Actually, it's a question I've been having in mind for a while because there's like a global fear for people that AI will replace their jobs or their roles at work, no matter how good they are or how dedicated they are. So my question is, Actually, you have been discussing for a while how AI tools will facilitate the healthcare system and will actually boost a lot of the healthcare enhancements, and also how to consider the sustainability measures in all the hospital emissions, and to take the ESG framework in the hospital. But actually, how do you think the healthcare professionals can be fully prepared and not actually so resilient to AI integrating in their daily workflows? So I put myself in their shoes, and I'm like, I'm a healthcare professional. I'm very dedicated in my job. I've taken all the development plans I can take, but at the same time, AI can replace me, and or actually can replace my job. So how do you think people can be well prepared for this? Because you've actually explained how the AI tools can be patient centric, or how can the patient be like their end user, or the thing we want to deliver the best services. But for the healthcare professionals, what do you think?
And you would have heard me saying a couple of times about the provider burden, right? Because I I completely echo your sentiments. Every time I work with on any initiative, it always kind of puts me into that, that question gets comes into my mind, that how much of the burden I'm adding to the already burdened provider community, right? And now going back to the question, so there are multiple aspects of this beautiful question. First was, would AI be able to replace our healthcare practitioners? I genuinely believe not. I would quote my couple of my doctors who I've worked very closely, and one of them said this to me several years ago, which has now become a very famous statement, that AI is not going to replace the providers. It cannot, because there will always be a human in the loop and will have to be in healthcare all the more. But what may happen, that AI may replace doctors who may not embrace AI, who may be resistive to the change. So I kept asking this question, that how do we make that happen? We have a lot of doctors who studied medicine in 70s and 80s, and they may not have that privilege of that digitally, I would say, knowledgeable to embrace such a fast, rapid pace of before bringing in some tool, Ahmed bringing in another tool, and they take time to absorb and kind of learn. So what we also genuinely advocate, and I'm a big advocate of that, is some of the skill development programs. The organizations need to invest on skill development programs. We launched a fundamentals of AI course internally, which is just very fundamental course. It's a web-based course. The providers go and understand simple terminologies like what is machine learning, and we give these hours back. So sometimes we have to invest as well, right? So we give a 1 hour of, or half an hour of time during, and we give some of these credits as well, so to make sure that they are taking these courses. So yes, you're right that they would have to start embracing. It is a cultural shift which everybody needs to invest on. The organizations, the medical community, the medical colleges are now tying up with AI universities to be able to bring this as an elementary knowledge into the curriculum, or at least, or having them be a lot more receptive to technology. But that's my takeaway, that one, they need to embrace, and organizations need to felicitate that embracing of technology and AI. Second, AI would definitely should not replace care providers. The clinical decision making, as we call as CDSS, would only assist in decision making, should not take decisions. It's a big debate going on globally, I understand, but we genuinely advocate, I think, across not just UAE, I've seen that across Middle East, that that the safe and responsible AI is a huge focus for us now, to make sure that everything is not causing any harm, or as we call in medical sciences, cause no harm.
Thank you, Vibert. This is actually more than sufficient to rest our fears, our common fears that AI might be replacing us at one point. And actually, this is absolutely tapping on the vision of the Center of Excellence, and actually the vision of the institution that we are part of. And all institutions, all academic institutions, including the Arab Academy and several more in Egypt and the Middle East, they are implementing not just training programs, but also educational and academic programs that can help um, business people alike and healthcare people with a background in healthcare how to understand the AI integration, how to utilize the AI for their benefits, and how to start incorporating it in their day-to-day work and their day-to-day operations, and introduce that in their own institutions as well. And that's basically the awareness we're trying to create here through the session today, and having you on board to enlighten us in all those realms and deliver such tangible models on how we can create a more sustainable and AI powered models that will alleviate any sort of burden on all beneficiaries, but also enhance the quality of services and of life of the people involved, whether they're the medical staff or the executive staff on top of such organizations, or the patients and the beneficiaries receiving such care. So thank you very much, Viber. Thank you very much for everyone who is with us. It's been a pleasure, and we look forward to having you all again in our future events. And of course, the recording for this session that is going to be extremely beneficial for the people who were with us today, or the people who didn't make it to the webinar, will be on our website and on our social media channels. Thank you very much.
Thank you so much. Thank you, everyone, for joining in.
Thank you,
Thank you,
Viver.
Steph.
Have a great night, everyone. Thank you.
Good evening, everyone.